All right, everyone, welcome to the Equity Circle podcast. We're doing a video interview today with one of Choice in CPAA's board of directors. So, David Windom, welcome to the podcast.
Well, hey, thanks for having me.
Absolutely. Well, thank you for being here. Can you just go ahead and start by describing who you are and what you do?
Sure. David Windom. I work for Mason County, so I'm the Director of Building Planning and Public Health. So it's an
Okay.
interesting mix of what we do here. And in addition to being the Director of Public Health, I'm also the Mason County Area Command Emergency Response Planning Chief for COVID response. So it's
Okay.
kind of two positions there.
Awesome. So one of the things that there's quite a bit that we want to cover today, and there's been a lot of, to give some context, there's been some confusion or maybe misunderstanding, as I know that the vaccine has come into play, that sometimes we've experienced breakthrough cases and sometimes, unfortunately, seeing people who are vaccinated either be hospitalized or die. And so I think today we really just kind of wanted to talk about what breakthrough cases you're seeing, and just kind of talk about some data. So before we get into that, though, I would love if you can just explain what the vaccine is designed to do.
Sure. So a vaccine, any vaccine really is an antigen. So an antigen is anything that comes into your body that inspires your body to do an immune response. So in this case, when we have the COVID vaccine, what we're doing is sending a message to the body to spin up your body's defenses and get ready and look for a specific kind of virus. So in this case, of course, it's the COVID virus. We've got the three different vaccines that do this. They do it in slightly different ways, but basically they're designed to just to supercharge your body's response and to be ready when it sees the invader, which is COVID.
Sure. So in hearing that and understanding that, I'm wondering if you can, we kind of touched on it a little bit in the beginning that you're starting to see some of these breakthrough cases. And so can you clarify, maybe more so in layman's terms, what is a breakthrough case and how does it happen?
Okay, so a breakthrough case is a case where someone gets COVID after they've been fully vaccinated. So if you've had the Moderna or Pfizer and you've done the 2 doses, or you've done the Johnson & Johnson single dose and you've completed the whole regimen, you've done your 2 weeks after that, you're considered fully vaccinated. Now, if you come up positive with COVID after that, that's considered a breakthrough case.
Sure.
And breakthrough cases are there to be expected. We see them with all kinds of vaccines, measles, any number of vaccines. You're going to have a certain percentage of people that don't get a good immune response. So when you get that vaccine, your body's supposed to spool up, and for some people, it just doesn't do that, and that's where you might get a breakthrough case.
Okay. So can you talk a little more about the specific areas that you are seeing it occur more often? I know you said it's expected in some ways because no vaccine is 100% effective. So can you talk a little about like some of the areas that you've seen it happen more often?
Well, right now we're seeing it surprisingly in our 34 to 49 age group category. We had expected maybe to see it more in the elderly, and you do that a lot of times with vaccines because as you age, you don't produce as good an immune response.
Sure.
And that's one of the reasons why the boosters are going out to the people over 65 right now and those that are immunocompromised, because they don't get as good an immune response. So we're trying to boost that up a little bit, boosters. Sure. What we're seeing in the breakthroughs right now is the 35 to 49 category. And that could be a combination of a number of things. You have differences in immune response, but you also have people who are out, they're active, they're living their lives, and they're probably picking up a larger viral load by, as they come into contact with other people.
Sure.
So,
sure.
And that may overwhelm their immune response. So it's surprising to see that particular demographic being that high.
Yeah. So with that specific demographic, is it specific to one gender or one sort of population? I'm just curious.
No, it seems to be pretty well spread. You'll see from a data standpoint, more women have gotten the vaccine than men. So okay. You'll actually, by data, you see more women having breakthrough cases, but I think that's a factor of, the denominator in this case being higher. So, mean, when you apply that factor in there, you automatically get more in women. But
Sure, sure.
it's a small difference. It really is. And in communities like ours, you're not seeing that much difference um, in that. We're not seeing it in the elderly groups. And
Hmm,
again, I'm very pleased with that. I think we've done a good job with vaccinating and cocooning those people around our elderly population and keeping
sure,
them safe.
sure. So it sounds like it is hitting that kind of more, you said like 30, 34 to 49 range. Is that right?
Yeah.
But it's not necessarily hitting some of the more elderly population, which is I know there's been a lot of concentration on because they're more vulnerable. Is that correct?
Right. So, I mean, when you just look at the straight data, it's showing that the higher number of cases. Now, keep in mind, it's another data thing. You have fewer elderly people, so you're going to have fewer cases of breakthrough.
Sure.
So, but where we're seeing the majority of cases right now is in that 35 to 49 category.
Okay, got it. So I know I kind of mentioned before, but some people have expressed hesitancy in getting the vaccine due to seeing those who are vaccinated still get the virus. So how do you respond to someone who is hesitant due to these concerns? And then do you have any statistics that can go along with that?
Oh yeah, I've got tons of statistics. So, I mean, I mean, I'm a total data nerd. I love this part of it. But what I would tell people is what we're seeing when you look at the status of who's in the hospital and who's dying. Um, the vaccine is doing a really good job in preventing severe cases, preventing hospitalization, and preventing death. So if you are in that category, that 35 to 49-year-old category, and you're unvaccinated, you're 21 times more likely to be hospitalized than if you're vaccinated.
Hmm,
That's a huge difference.
sure.
Um, so you've taken away a layer of protection by not getting vaccinated. True, you may contract the disease. You may have a much milder case though.
Sure.
Um, so you've added a layer of protection, and that's kind of what we're doing with all these things. Is we're trying to add pieces. So vaccination is one piece, and wearing the mask is another piece. You're just kind of adding layers of defense to your system, and vaccines are very important in that. And as far as data goes, I was just looking at the data this afternoon. So some of my latest data is as of like October 13th, and 21 times more likely in that age group. And then what we're seeing in our actual results at the hospital, when we see it here in our local hospital,
Sure.
95% of our cases in the hospital are unvaccinated,
Hmm,
and that's very telling. You know,
yeah. Yeah.
we've had a few vaccinated people who have passed away, but very few people who have been vaccinated pass away. It's really the unvaccinated population right now are those that are occupying our beds in our ICUs and in the hospitals. So it's very telling that there's a protective factor there. Is it absolute? No, no vaccine is absolute.
So, kind of in summary, just so I get a clear understanding here. So, you're saying that although there are some breakthrough cases because no vaccine is 100% effective in terms of preventing a virus, you're saying that despite that, there's still a larger number of people that are unvaccinated that are in the hospitals. And then you were kind of talking about that 35 to 49 range age range that is 21 times more likely to be hospitalized if they are unvaccinated. Is that a fair summary, kind of what you shared?
Yeah, that's a pretty good summary. And of course, those numbers change as the Delta variant has changed what we were seeing. You know, early on we saw a much older age group in the hospitals, but with
Sure.
Delta, we're seeing that age coming down. We're seeing uh, teens and pre-adolescents contracting the disease. But this provides like I said, a level of protection, especially from severe disease, hospitalization, and death.
Hmm. So you kind of touched on it a little bit, but it's kind of a follow-up question is why should we trust the vaccine as a strong solution to get out of this pandemic? You kind of touched on it a little bit with obviously some of the data that's showing those that are being hospitalized that are unvaccinated. But can you talk a little about the this kind of level of trust we should have with the vaccine and as a solution to come out of this?
Yeah, you know what? Early on, when the vaccines came out, there was concerns about a number of things. and one was young males with having heart problems after the injections. And what we found is they've all recovered. We've so that has not been, and it's a very tiny amount. And then when you look at the breakthrough cases, we had about 54,000 breakthrough cases in the state of Washington so far, out of 4.5 million fully vaccinated people. So fully vaccinated, 4.5 million, 54,000. You're talking about a 1.13% breakthrough rate. So that's pretty good protection in my book. In fact, it's better than I had anticipated. I think that speaks for the vaccine and its protective factors. So look around. You know, the folks that have gotten the vaccine are going on about their lives. We're just not seeing that kind of breakthrough and people in the hospital from that. So I think we should trust that. But again, it's not just the vaccine. And I'll have to say, people who tend to vaccinate are concerned about their health, and they're wearing their masks, and they're washing their hands, and they're avoiding, risky situations. So all those things work together to build your best defense.
So it sounds like it's a matter of trusting the vaccine and its effectiveness. You kind of talked about the ability for people to kind of go on with their lives, but it's also kind of adding the washing of hands and the mask that's really helped kind of keep that number and those breakthrough cases low as well. Is that fair?
Yep, I would say that.
So David, I've really appreciated you just kind of bringing some data and some numbers. It's always good to meet someone who loves data. It's something that I'm not very good at, so it's always good to meet someone and have someone who can just kind of talk about the numbers and what it's looked like. So I really have appreciated having you on. And so as we come to a close, I'm wondering if there's any final encouragement you would give to us as we or anything else that you would like to share today.
Yeah, I would. So, I'm into this all the time, and I'm enthusiastic about data. But if you want to find out for yourself, Washington has a great dashboard. So just Google Washington COVID dashboard, and the page comes up, and you can explore. There is a wealth of information that you can look up for yourself. Sure. and give yourself some assurance by looking at the numbers for yourself. Make your own interpretation of what you see in the data. You don't have to take anybody's word for it. Look it up and make those reasoned medical decisions about yourself. Yeah. And I have a great confidence in the vaccine. I think it works well. It works especially well in conjunction with those other things. And I think that's our key to coming out of the pandemic is you build layers of defense, not just one thing.
Well, thank you again, David, for taking some time out of your day to kind of break this down for us. We really do appreciate it. I want to thank you to our listeners for listening to another episode, a video episode of the Equity Circle podcast. Please leave us a review and share with friends and family. We're on Apple Podcasts, Google Podcasts, and more. And lastly, remember that equity equals progress.